Patients receiving home care services are often housebound, making focused on-site wound assessments critical to improving healing outcomes. While wounds are assessed and treated in a standardized practice by wound presentation and response to treatment care plans, there's little consistency in addressing contributing factors that may adversely affect healing in these patients. This translates to inconsistent care coordination, which can delay ancillary care services or have referrals missed entirely, jeopardizing patient outcomes. This brings us to this project's PICO question. In adult home care patients that are admitted to home care services with a nutritional risk score of moderate to high risk, how does the incorporation of a triage care coordination algorithm impact care access to resources over 4 weeks compared to patients not receiving a care coordination algorithm for resource care access? The project design. The Wound Care Champion RNs performed admissions to prospective patients and implemented the triage care coordination algorithm workflow. All home care patient referrals were screened for those meeting patient project criteria and scheduling with the Wound Care Champion RNs. They had performed an assessment of the patient project participants and also non-project patients, determined home care agency response and receptiveness to workflow change, and addressed patient satisfaction and care coordination and timeliness. The results in non-project participants, 3 out of 20 had received social working by 4 weeks, 1 out of 20 a dietitian, 19 out of 20 a provider within this time, and 13 out of 20 had labs within 4 weeks, only 4 of which were project-specific labs. In the patient project participant group, 50% had received social working within 2 weeks, 100% providers within 2 weeks, and 75% had labs within 2 weeks, 50 of which were project-specific labs. Project threats and barriers and tactics used to overcome and facilitate. Case management RN enrollment to the QI project was slow and conservative. A pre-invitational email was sent prior to the formal clinical project introduction email. Follow-up email was provided 3 business days after the project introduction. Individual calls were also made as needed for checking in and Q&A. Patient project participant enrollment was slow. Patient project participant age criteria was increased to 18 to 85. Check-ins were made as well with the intake referral RN. And lastly, staffing was challenging. Non-scheduled days were worked by project lead to increase the number of prospective admission screenings, and Wound Care Champion RNs volunteered were able to pick up